Dr. Carmen Nevarez, thank you so much for being with us today. This is the APHA 2018, and I know that you are a leader in public health. Could you tell us a little bit about you and what you do?
Thank you so much, Pietro. It's a real pleasure. It's a real honor to be asked. I am currently the Vice President for External Relations and Preventive Medicine at Public Health Institute, which is located in Oakland, California. I run several programs. My sideline program, which has been going for about 10 years, is called Dialogue for Health. It is an internet-based broadcasting system that does somewhere in the neighborhood of 20 to 30 broadcasts a year on big public health dialogues. We have about 26,000 subscribers across the country and get a lot of interest. The other work that I do is in leadership development, leadership and capacity development, and we have been working in that area for around 9 years. We work with intersectoral teams and help them to learn the skills that are necessary to be successful doing collaborative work for the public's health. It's called the National Leadership Academy for the Public's Health. It is a flagship of the Centers for Disease Control, and we are continuing now in our third round of funding from CDC on that program. We've done an offshoot of that program for California called the California Opioid Safety Network, where we're working with all of the opioid safety coalitions across the state of California, helping them to learn their most effective skills to address the issue of stopping opioid deaths.
Fantastic. So it sounds like you wear many hats and been doing many different things. But for those who don't understand exactly what public health is, what is public health and how does that connect to what you're doing?
Public health is about finding the way for everyone to be healthy. So for us, and how that connects to my work at PHI, it is helping community groups, public health departments, public health leaders, policymakers, community members. It's helping them to define and then move towards goals that help everybody in their community to be healthier. It's not about a program or a service. It is about building a solid bedrock of capacity to help everybody, every single person in a community, to connect to the idea that they deserve good health and that there are pathways to that, and that there are many ways in which, both in seeking services, but also in building connection between them, to find what they need in order to live a healthier, safer, more fulfilled life and really achieve all of the promise that they have in this world.
Great. So it sounds then that the work you do goes beyond the walls of the hospital, as many people understand at health, but this is more complex. It's kind of getting people health through all the different means of your work.
That's very true, and I want to just say something about that, because my connection with the Latino Caucus actually is born out of that realization. Back, I think, in 1982, I was practicing as a physician and practicing in a low-income community, which had always been my dream. But I always felt like there was more to be done and that I could do more. And I came to a Latino Caucus event, and I looked around the room and I said, this is where I belong.
This is where you belong.
And I went to other public health events, and I saw the very strong conversation about social justice. I'm in my pod. I know exactly where I'm supposed to be. And so I changed everything and went from clinical practice into public health, because it was clear that that's really how you move for the equal opportunity for everyone to achieve maximum health.
And you mentioned two very interesting words, social justice. So people wonder, what is the connection between an MD and social justice?
Well, there are many. Every time that you are able as a physician to really build a sense of empathy in yourself and understanding of what the conditions are that stand in the way of people achieving their best dream for themselves and for their children and for their parents, then you're connecting more closely to an agenda around social justice. Social justice is a level of achieving social justice is something that needs to happen if we really were able to be the the nation, the community, the sector, if we were able to do everything that we could do with what we have, that would be achieving social justice. If we could just move all of our capabilities. We have so many capabilities that never get tapped, where the doors are shut down in front of us, or where the funding isn't there, whatever it is that we think is their obstacle, moving past those obstacles and having the agency to do that is really the key to moving that forward. And I said the word funding, but it's not really about the funding. It's about knowing that you have the will, knowing that you have the vision, and moving it.
Well, that's great to hear that. And I was wondering, you're an MD who is involved in social justice. Is social justice part of the curriculum of medical school, medical trainings?
Hardly, which is exactly why I felt very disappointed when I got out of medical school. I knew a lot of technical things. I knew a lot of things about the other people that were in my profession with me. I knew that they aspired to personal success. I knew that they defined that in terms of their practice and their homes by the lake and their boats. Because that's what they said. I mean, I'm not making this up. That's what they said.
Right.
And I knew that there was something way more important to be done, and I did not get it in medical school. Fortunately, before I even went to medical school, I had gone to university here in San Diego at the Third College, which was started by a number of very brilliant minds, and the history is well documented. But at that point, I'd had the opportunity to read authors like Norman Bethune, and other physicians who had really moved their practice into understanding that it's not just the person in front of you that you are treating, but it's understanding all of the antecedents that lead to that condition and moving to address those. So when he said that tuberculosis was not caused by the bug, it was caused by the environment, by the cold, by the exposed lives that poor people were leading, that just was like, that was such a revelation to me, because I knew that was true.
Right.
Just from my own growing up in California, I knew that was true.
That made sense.
Yeah, it's so true. I mean, if you put the bug in front of 20 people, they're not going to get it unless they don't have the internal, the physical, the emotional, the housing, all of those supports in line. Those are the ones who are vulnerable.
Well, thank you for sharing that, Dr. Nevarez. And for those people who are coming, these new generations of providers in the health field, either public health or medical care, do you have a message for them?
Sí se puede.
Sí se puede.
Sí se puede. That's my message. We are in an extremely privileged situation. And it is, I believe, our responsibility to share what we've learned, to help lift up others, and to assist them to lift themselves up, to join forces, both amongst ourselves as Latinos, but also in the community more broadly, because we need to be a part of something much bigger that moves an agenda for social justice. This will be a great country, a really great country, when everybody in this country has the equal opportunity to be healthy, to be educated, to be safe, to be free of fear and violence, to be fed. And I think maybe just going back and putting a big underline to be educated, because I wouldn't be where I am if I hadn't had the opportunity and the pushes to really achieve what I needed to achieve with my education.
Thank you so much. Thank you so much for sharing with us, for sharing your knowledge. And it's very exciting to see your passion, and your care for the Latino community. So thank you for being with us today.
Thank you. It's really appreciated.